Hi, my name is Swati Wagh and the Science Outreach Librarian at Benedictine University. Welcome to this class, and today I'm going to walk you through what PICO is in NRHL 3330. Okay, so let's start. This will be the default page for you when you want to get into Benedictine University. Then to the library. You can log in here. You don't have to log in to get into the library. You just click on the library, and then this is the place where you're going to be. Now under this, there are databases that you're going to be searching. Okay. I am going to go through databases, 3 of them. One is CINAHL, which you know, Cumulative Index to Nursing and Allied Health Literature, PubMed, and Medline, which is a subset of PubMed, which includes only journal articles. So that's what you want, primary literature. Okay, so here we go. Before that, I wanted to give you some background information on what is PICO, how to go about formulating a search strategy, and for that I would like you to go through this research guide that we have for you. And in that research guide is going to be a PowerPoint that you're going to follow right now. And then from there, I'm going to do a live search in all these 3 databases, giving you a search strategy. Okay, so let's go. Here is where we are going to go to our program. I'm going to NRHL 330. This is where I'm going to be. And on this, I'm going to start first. You can look at it for yourself what it is. Boolean searching we've been through before, but I just may give you like a brush up on that topic. And in PICO, this is where you're going to be looking at. And this is what I was going to tell you about, right? We're going to open this and then follow this. And I'm going to do this full. And here is where you're going to be looking at. Take note of my number, 847-312-4845. And here is, by taking an actual search, I'm going to walk you through the databases in CINAHL, okay? And here is music therapy for pain management in children. The first step is to find out what the keywords are. And the bolded words are the keywords that those are the concepts that you're going to be searching, right? And then from there, we are going to the form that we are going to use. You can print this form out, keep it handy, and you're going to have patient problem or population. That's P stands for. I stands for intervention or exposure. In this case, it's going to be music therapy. Comparison control, we don't have any. Outcome, we don't know what's going to happen, so we're going to leave that a blank. And we don't have the time factor. It doesn't say when the intervention has to occur, so we'll keep that blank too. Or how long you're going to be doing. Do you think that music therapy will be effective? We don't know that yet, so we're just going to find a preliminary importance of music therapy in pain management. Okay, now patient and problem will give you what it is. Patient population of problem is children, or pain management, that is it can be intervention is going to be music therapy, but we are going to, the patient population that has pain is what we are going to be looking at. So that's why the problem patient is pain management. Okay, comparison control is like absence of music therapy, what happens. Okay, and then from there we'll go to the next one. And these are the keywords from the previous. You know that or is used for synonyms or related terms. Okay, these are going to be related terms. We're going to put in an or. And is when you want all the concepts of children and pain management under and music therapy to be in that, in the text of the article, or in the title field, or in the abstract field. major parts of the article should have these words. That's what we are going to be searching, okay? And then we did that now. So now I'll stop here and I'm going to go to my library homepage again and go back to databases. That's where our search is going to be, okay? Now you have to remember this is what the keywords are and how we are going to go about using them in or and or not, okay? Go through that same PowerPoint that will give you more information on that or make you remember what is what. Okay, we are going to CINAHL, which is Cumulative Index to Nursing and Allied Literature. Now, on this page itself, right, most of the times they ask you to look at current 5 years, peer-reviewed, and also you want to say any author is nurse. Okay, they want a nurse as author. So when I am here, I'm going to put this in there. Okay, and you also might have noticed there is evidence-based practice. So if you're going to look for EBP, which will be my next topic, this is where you will go to do the search too. But let's not get ahead of ourselves, right? So I know that I'm looking for pain management with music therapy in children, right? So I'm going to put the first term as children. And then what does it tell me? That is the beauty of this database. It gives you the synonyms and related words all at once. So you don't have to think about what it could be, okay? And then I want an and here because this is what I want, right? And then the next concept I want is pain management, right? Pain management, pain relief or pain control, or right? And then we also want, it could be an or here because the patient population that has the pain. So it could be and or it could be or. Let's do with the or first. And then I'm going to say music therapy. But I think the concept of and is better because we want all these concepts in there. So I'm going to put that back. And I'm going to put again music therapy. And then what does it tell me? Music intervention or that, right? So now I'm going to start looking at it. Say search. And I get 7, which seem to be very, this is exactly what we wanted, effects of music therapy. And take a look at what were the subjects here. Subjects are the same as subject headings. And like I said before, if you look at that PowerPoint, it will tell you that we are mapping this keyword into the terms used by the indexing system, which is EBSCO, okay? So here, just remember those. That means ours is right on what target, what we want, infancy and childhood. Pain, all of these, non-pharmacological pain, we can look at all of these and see which ones. You can say all, and that'll be fine. I'm going to put it in my folder, because that's what I want to look at later when I'm done from here, right? And then if you want the PDF, it links, and then here it doesn't say we have it, so click on the find, and it will tell you where it is, whether we have full text access to it or not. Okay, let's load it. And then we get it through Ovid. That's another database. See the PDF? So you can download the PDF too, okay? So let me get back to my results page. And so I'm very happy with this search. I'm going to say, put all of these in my folder, and then I'm going to say, I want to go to the folder view, okay? And once I'm in the folder view, I can do something. I can do export it or email to myself. I'm going to email it to myself, And then I want to give you the APA 7th edition, okay? And then this is, it will go to me, email to my name, right? But you can put in your name and it will be coming to you. So you know how to format it for your bibliography, okay? Now go back to the search, and then I want to show you something else. I told you there's another way to do this with controlled vocabulary, which is subject headings. That is exactly what the indexing agency does. It takes all the keywords we came with different keywords, right? Children, adolescents, youth, and then it maps it to one word, which is child in this database. But we'll do that actually, okay? And so I'm going to say CINAHL subject headings. And then I'm going to put in my relevancy ranked is good because it tells you how many times that word appears or the subject heading appears in this database. So we want how many, the most maximum time it has been mentioned in this website. So here I will put in children, just like I did before. And what do I get? Browse. It tells me you children, use child. So I'm going to use child here. And then it will take me down to kind of children, like abandoned, adopted. We don't want any of these. We just want the child. We don't want the subheadings under it. In which case, if we wanted all of these words, we would have said explode. Okay? We don't have that. You can also put child or infant here. And I'm going to put it as an or because these are two synonyms or related terms, right? Child or infant. So it comes in or, and just leave it there. You see that? Don't worry about these things, these parts of subheadings yet. We'll come back to it later. Now I go back here to my first screen here, and then I'm going to say pain management. And then I will look at browse again, and it tells us pain management is a word there, subject heading, and then this is what I'm going to do. It's the pain management is the last in this hierarchy: patient care, disease management, pain management. Okay, and now I'm going to do an and because I want all these two terms combined with pain management as an and. Okay, then the last concept we had is music therapy. So I'm going to put music therapy, see what I get. Music therapy, and see what I get. And I got here music therapy, and then it tells me music therapy is on a standalone. So I'm going to say okay, music therapy, and then I'm going to say it's an and, because I want the concept of pain management through music therapy. And then all I have to do is click search database. Okay? And this is what I got. I got 7,757, right? But remember, this goes way back 1943. That's too old. So I'm going to go back to 5 years current. Okay? I got 7, but that's okay. And out of 7, I'm going to go back and again go back to my language. These are the filters that I called before. And it's still 950. And then I'm going to say, try and get as less number of records as possible using these same concepts. Okay, this should have been an or, not and, or infant. So I'm going to change it to or. That's what you have to do. You have to go back and check whether everything is correct. And then I also want to go back to, they did not apply the nurse as author here. So I'm going to look at and say, show more. And under the show more, it takes me to the first page. And then I'm going to say, I want any author is nurse. And then say refine. So you got the gist of what I am doing now, right? and there is only one nurse as author. All the others were not, nurses were not the main authors in that. So here, this doesn't seem like it is relevant, so I'm not going to look at it. So that means subject headings here is not doing a good job. So let me go back and see what I can do to make this search better. I'm going to put music therapy, take that out and put it as keyword like we did before, and see if I get something better. And then okay, I don't get it. So subject searching in CINAHL for this is not good. So just remember that, okay? Not all time the database searches will be perfect. But here there is something which, it's not and, it should be an or. I don't know why it does and. So I'm going to do this or again, right? And I'm going to say this. Okay, I got 2. Now this seems more correct. But we don't want management of the pediatric patient with autistic spectrum disorder. That is tooth extraction, anesthesia. So that is like perioperative 8 to 12 years. So this is relevant to you, right? And then if you get these 3 and then you get these 2, you got 5 of them. Effects of music therapy on cards in pain. Let's look at distraction cards, right? The music is a kind of distraction for children. And so here I'm going to click on something called find similar results. I wasn't happy with all of the others, right? I like this one. So I'm going to say find similar results. And then it will tell me there's 400, that's too many. So I'm going to again go back to go and do that. And then limit it to again remove. See what I get. Pain relief. Effects of 3 different distraction measures on pain and anxiety in children. But here I want music therapy, right? So I'm going to put music therapy here again. And remove it. I'm going to put that in the title field because that's what I want the main focus of the article to be. And I get 193. So this seems more accurate. So you can look at each one of them, and if we don't have the full text, you can always get on interlibrary loan. See this one here? Interlibrary loan, it's all filled in. You just have to hit submit request and it will come to you as an email. They will tell you where to go and find the PDF in that email that they will send you. Okay? So this is briefly what searching in CINAHL is for PICO. Now that I'm here, I don't want to go out of this. I am going back to my results set, and I have the same fields, all of it. But now I'm going to look for evidence-based practice. Okay, so I'm going to go back here and say I want show more options, and in this I'm going to add evidence-based practice for your next search, which was going to be on evidence-based practice in CINAHL. So I'm going to do it right here, any author is nurse, and then refine and see what I get. I get only one. So this is again, we can go back with that one for evidence-based practice and look for similar results and then see what we get. Okay? We get a lot more, but then again we go on adding these filters and then limiting it to what we think is the good set for our information. So this is briefly what we are going to do in CINAHL. Next, I'm going to go to Medline and then I'm going to go to PubMed. So bear all in mind what I just said, okay? You have to remember it and then look at that. If you have a problem, print out the PowerPoint and then keep it as you're doing your search, so you know exactly what to look for in terms of keywords and stuff like that. So it's very important to know that if you need any help, please call us. My number is 847-312-4845. If I am not around, there are other capable librarians who can help you too. So you don't have to ask for me all the time. You can get help from the others too. Okay? Thank you for listening. Bye.